Hi, everyone. My name is Tara Nelson. I'm a nurse practitioner. I work over at BC Cancer in the radiation oncology department. I may have met some of you at some point in time. I work with the radiation oncologists that treat prostate cancer, as well as lung cancer and palliative radiotherapy for symptom management. And I'm happy to be with you today and to chat with you a little bit about heart health, which is something I think is really important, no matter who we are, what medications we're on. And I want to chat a bit today about why it's important for those of you that have already undergone treatment or will be undergoing treatment for prostate cancer. So let's get going. So, why does heart health matter during prostate cancer? So, some prostate cancer treatments, you may have heard the terminology hormone therapy or ADT or androgen deprivation therapy, which is a mouthful. While these are invaluable for treating prostate cancer, we couldn't treat prostate cancer effectively without these medications. They can increase cardiovascular risk, which is also kind of just a medical term for heart health. These medications have a mechanism whereby they block testosterone in the body, and that's really important for treating prostate cancer. But the overall picture for the heart health is that it can actually make some other parameters more difficult to control. So things that are important for heart health, such as cholesterol, blood pressure, blood sugar, healthy weight. These things can all be impacted negatively by hormone therapy or ADT. And those with pre-existing heart conditions or maybe have had heart attack or stroke in the past or already have high blood pressure, it can worsen some of these symptoms or cause some of these symptoms to potentially recur or make things harder to control. So the good news, though, is that lifestyle and routine monitoring can reduce the risk. So what is a risk factor? What do we mean when we say risk and risk factors? So basically, a risk factor is something that increases the chance of developing a disease. So something that people are very familiar with, it's been kind of in the mainstream media is say smoking and developing lung cancer. We know that if someone smokes regularly for a long period of time, that they're more likely to get lung cancer or potentially get lung cancer. Um, things like being out in the sun for long periods of time without any sun protection can lead to developing, skin cancers, things like that. So how does risk play a role, or risk factors, that is? So when it comes to risk factors in heart health, we have what are known as modifiable and non-modifiable risk factors. So modifiable risk factors are the things that we can change potentially. So diet, physical activity, smoking, stress, alcohol intake, blood pressure, cholesterol, blood sugar. These are all things that can potentially be controlled via lifestyle or medications. Non-modifiable risk factors are things like our age. We cannot control our age as hard as we try. We can't control our gender or our 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 sex. If sometimes certain conditions are more prone in males, versus females, and vice versa. We also cannot control our family history. So if we have, say, a mom or a dad, or maybe sisters and brothers who have a lot of heart disease in the family, have heart attacks or strokes at young ages, this increases our risk just because we are related to them. We also can't change that. Our ethnicity, some folks from different ethnic backgrounds just have genetically have more risk when it comes to, say, heart disease, diabetes, some of these other conditions. So the good news when I look at this slide is that our list for modifiable risk factors is a lot bigger than the non-modifiable. So that means we have a lot of things that we can change or potentially make better. So this slide's from Hypertension Canada, which is our big guideline body within Canada, they solely look at blood pressure, but in reality, a lot of their suggestions and recommendations really cross over to kind of just general health. Um, so um, Hypertension Canada focuses on health behaviors such as physical exercise. Are people getting, daily kind of moderate intensity exercise? Weight training? Are we building our muscles, keeping our bones healthy? Maintaining a healthy weight. We know that as weight creeps up, we end up with more difficult time with, say, controlling blood pressure, maybe controlling cholesterol, blood sugars, some of these things. Alcohol consumption is a big health behavior because it's something that we may do socially. It's very socially acceptable, but do we know exactly how much we're drinking, or do we know what the Canadian guidelines, or what do they even recommend as a healthy level? When I look at this slide from Hypertension Canada, they still speak to the previous safe alcohol consumption guidelines, which were back in 2020, where 2 drinks a day were seen as acceptable. That changed in about, I think, 2023 or so. And I will speak to that in a moment, where this number was actually reduced quite significantly, because we now know that there is increased risk by having more alcohol per day or in a week. So I'm just going to shift over to the movement guidelines. So this is the Canadian Society for Exercise Physiology. So again, they are another one of our very credible guideline committees in Canada, and they look at kind of healthy activity levels. So what's nice is they also kind of take a whole picture and also focus on how much we sit and how much we sleep. So it's not only how much do we move in a day, just from physical activity. But now that we live in this world where screens are very important, people spend a lot of time sitting, a lot more time sitting than they ever used to. We used to be quite busy human beings working outside or doing more physical work. And over the decades, that has slowly declined to whereby people sit behind a desk, behind a screen now a lot of times. And as we age, sometimes we also, because of maybe underlying ailments, um, you know, uh, sore knees, sore hips, these kinds of things, that we might not move as much as we should. So the Canadian folks here, they recommend that for physical activity, we're getting about 150 minutes per week. So that's usually adds up to about 30 minutes a day of moderate to vigorous activities. So you want to be walking such that, you're out of breath a little bit and you have to work a little bit. You don't have to be out running marathons or anything. It just takes sometimes just a little bit of, uh, kind of picking up your speed with walking and making sure to strengthen those muscles as well. Light physical activity throughout the day, getting enough sleep. This can be a challenge for some folks, especially with gentlemen with prostate cancer, if they're having a lot of trouble, maybe with having to get up at night to go to the washroom. Chat with your physician or your oncologist or urologist about this, because it can really cut into your good sleep time. And when we're tired, then we don't feel like doing much in the day. And I chatted a bit about screen time already. So, limiting screen time as much we can and doing things outdoors or doing things that are a little bit more active. I see a lot of folks playing pickleball now, things like that. So when we're talking about alcohol consumption, this is something that can easily be kind of uh, something that we don't realize how much we're consuming potentially. So the new guidelines look more at a continuum of risk. So it's recognized that alcohol does contribute to many cancers, and by reducing our alcohol consumption, we can potentially reduce risk. So drinks per week, obviously, this would be the ideal, but this is not probably, for many people, not realistic. So they recommend low risk alcohol consumption being 1 to 2 drinks per week. So you can see that that's a dramatic decrease from what the old guidelines were, two or less per day. So once we get up to 3 to 6 standard drinks per week, which really, that's 1 drink a day, not even. You're at moderate risk already. It can increase risk for several cancers, including breast and colon cancer. Then once we start to reach 7 or more, there's increased risk on our heart health, for heart disease, stroke, um, and of course, cancer. So what what is a standard drink? People say, well, okay, so what's a standard drink? And I'd say most of us probably, if we're pouring ourselves, probably, if I'm being truthful, I probably pour more than a 5-ounce glass of wine, and I will call it one glass or one serving. But in reality, 5 ounces of wine is not an awful lot. Um, and then, a 12-ounce beer, 1.5 ounces of spirits, or a can of ready to drink alcohol. So sometimes it's just being mindful and looking kind of just kind of measuring or keeping an eye on what you're actually consuming. So if we go back to some of our health behaviors, other things that we can control, sort of maybe modify, is our diet. So it's the old adage of you are what you eat. And I think that's, it's always resonated true that, having a diet that has a lot of fruits and vegetables, low fat, low saturated fats, low salt, versus packaged foods. It provides all the nutrients that our body needs and helps us to control things like blood pressure and cholesterol levels. There are some, if you went to any of the other talks that Island Prostate Center puts on, I know they have a dietitian come in, and I think there's some videos in their library as well. So, there's definitely availability out there to chat with dietitians. If you're at the Cancer Center, we have dietitians here as well. So feel free to reach out to your oncologist or anybody who's part of your treatment team or management team if you would like some tips or to chat about diet, because we definitely have resources for people. Sodium intake. Sodium's kind of an important one because it creeps into a lot of packaged foods. So sodium is not only kind of what we put on with our salt shaker that we can visually see, but it sneaks itself into a lot of foods because it's used as a preservative, and it also tastes good to us as humans. We like salt. So kind of just being mindful of how much you're taking in a day, not putting extra salt on your food. Um, I'm going to pass over the potassium because that is more of a thing for blood pressure, and it's not really not anything that we would focus on with regards to prostate cancer necessarily. But stress management, this is an important one as well, and I think it's kind of across the continuum, to kind of be mindful of how you manage stress. Some people like to, they'll maybe consume more alcohol, or if they're smokers, they may smoke more to help with stress. And we live in a stressful world these days, so that's something you can always chat with your family doctor about. Or here at, the Cancer Center, if you're finding that your diagnosis is something that is kind of weighing on your mind, and it's you're having any difficulties kind of um, coping with that, reach out to us because we also have access to counselors here through the agency that we can put you in touch with. So please do reach out. Smoking is one that is, still relevant. There are still a lot of people that are smoking. Vaping, is for as much as we know, probably just as harmful as smoking. Quitting rapidly lowers risk of heart attack and stroke, and the negative impacts on the body can easily, or not easily, but they can be turned around in quite short order after quitting smoking. So there are a lot of great smoking cessation tools out there nowadays, whether it's nicotine replacement or medications that help with quitting. There's a lot of great information out there, a lot of great resources like Quit Now BC has free programs. It's available for all BC residents. They have support groups as well. Um, and a lot of the nicotine replacement products can be offered free of charge as well through Quit Now and through your local pharmacy. So if you're interested, talk to your oncology team, talk to your local pharmacist. Um, you can talk to your GP or NP about available treatments because it really will, it's never too late to quit. Sleep and stress, I already chatted a little bit about ensuring to get enough sleep every night because it does impact, some of these parameters, these cardiometabolic parameters. It's more difficult to control sugars, blood pressure, cholesterol if people are also sleeping poorly. And we chatted a bit already about stress management and stress management strategies. And like I said, just reach out to us here at the Cancer Agency. And we can put you in touch with counselors if need be. And also take a look at what Island Prostate Center has in their resource banks. They have a lot available as well. So what about blood pressure? Why do we care about blood pressure anyways? Most people say, well, I don't feel any different. I have high blood pressure. I don't feel any different. Why does it matter? So, um, blood pressure is the force of the blood pumped from the heart against the blood vessels. So, this force makes blood flow possible, delivering nutrients and oxygen to the organs and tissues throughout the body. High blood pressure happens, or when there's too much of that pressure in the blood vessels. So you may not feel different, but over time, that higher pressure can cause damage to those vessels, whether they're big vessels like the big ones that feed your heart and lungs, or the really tiny ones that are in your eyes and your kidneys and such. Um, and having uncontrolled blood pressure can just cause all kinds of troubles. So stroke, heart attack, eye problems, it's linked to dementia, um, um, all kinds of things. So ideally, if you are going to be started on hormone therapy or ADT, androgen deprivation therapy, I think it's a good idea to reach out to your family doctor or a nurse practitioner. Let them know that you're being put on this therapy. We do copy um, all the primary care providers on our notes, but I think it's really important for people to be advocates for their own health and to, touch base with your doctor or your NP and say, hey, did you get the notes from the cancer center or from my urologist? I'm going to be put on this medication. Is there anything we should do? Can we make sure my blood pressure is okay, that my cholesterol is okay, that my um, what we call glycemic markers or markers for diabetes or blood sugar are okay. It's always a good idea to, review the basic things like, you know, weight, weight and height and body mass index. smoking status, diet review, physical activity. So basically all the things that I just reviewed. It's a good thing to go over that with your physician or your NP. And then ongoing, it's a good idea to just check, check your blood pressure. You can visit your physician or your NP. You can go into a pharmacy. I encourage most inpatients that I chat with to pick up a blood pressure monitor that you can get at the pharmacy. And usually the pharmacist can show you which ones are kind of quality brands. And then you have a little blood pressure monitor at home. You can check your blood pressure with, in a setting that is stress-free. It's not a clinic and it's the most accurate. And you can keep an eye on your own blood pressure. Um, and ensuring that you're following up with your doctor maybe a little bit more regularly. Um, when you are put on any of these medications. And of course, if you have any symptoms like chest pain, shortness of breath, or, palpitations that are, new and different for you, those need to be, investigated immediately. So know your numbers. So just like PSA is an important number for prostate cancer, we look at that very regularly. Other numbers are important for heart health. So as I mentioned, blood pressure, um, our Hypertension Canada guidelines folks, they have recently decreased the level that we would consider as high blood pressure. So they're making the targets or the levels a bit more aggressive because they've recognized that early treatment of high blood pressure is beneficial overall for people and for blood vessel health. Cholesterol levels, know what number you should be at. A lot of people are on medications called statins. They're very common. They've been proven over and over and over again over the decades to save many lives. A lot of people are on them. If you're on them, you can always ask your doctor, am I at the right level? Am I at the level I'm supposed to be? Am I at target? Um, if yeah, if you have diabetes, most people are on these medications. Blood sugar, if you are um, diabetic or pre-diabetic, know what numbers you're at. If they're changing, um, ask your doctor if you're due for a repeat blood work, because we know that the hormone therapy can make it harder to control these blood sugars. So you may have been going along for quite some time, just kind of on the cusp, and most family doctors would say that's fine, just watch your diet. Um, and so then if you're put on this medication, then it just makes it more difficult to stay on control of those numbers. And so, make sure that you're double checking with your family doctor or a nurse practitioner to see if you're still, staying within the right level for your blood sugar numbers. When you do come for your consultation, tell your oncology team if you've ever had any issues with your heart or investigations with your heart. Um, if you've ever had a stroke or heart attack, if you have diabetes or high blood pressure, um, make sure to let us know all that information so it kind of gives us a good picture. For some people, it may be beneficial to see a specialist, and we often will refer off to a specialist just to say, hey, can you ensure this person is their heart health is in as best shape as can be, because we're going to be having them treated with hormone therapy for, you know, X amount of months. And as I mentioned, it's always good to follow up maybe a little bit more regularly with your family physician or nurse practitioner, especially if you already have a baseline or underlying cardiovascular disease. And lifestyle factors are really important. So what we do on a day-to-day basis may seem small, but it adds up. So, taking a walk every day may not seem like you're doing much, but it really does add up over time. So I just wanted to play this little video And it always gives me a little bit of food for thought about kind of how we look at things and how we look at the day, the time that we have available in a day. Okay, so that is a good video that just gives us a little bit of food for thought about the impact of kind of exercise on our overall health and the impacts of moving more. So just to end things off, there's an abundance of information out there these days. Um, you can go to some of the big, if you're if you are a good computer, you like to kind of search things out on the computer, you can go to like Hypertension Canada, some of these other big guideline committees in Canada that often have a whole section just for patients. So they have, like, for example, Hypertension Canada has a blood pressure action plan. They have a section where they have a blood pressure log. They have a list of credible home blood pressure monitoring devices, all kinds of things. If you're diabetic, Diabetes Canada has a lot of good information. Um, but you can seek out information by asking, if you have a GP or NP, ask them where you can get kind of more information, where are some credible resources. You can ask us at the Cancer Center. Of course, Island Prostate Center has an abundance of resources. So, there's a lot of different avenues out there to kind of get more information about, how can I, um, you know, improve my day-to-day, say, um, fitness level or diet, or how can I modify these lifestyle factors? How can I live a good lifestyle with prostate cancer? Some other resources, of course, Heart and Stroke Foundation, um, Quit Now BC, I chatted about, the Canadian Cancer Society. And that is it. Thank you for your time.